What we've been doing is running a conference for GreenSpace specialists and for public health specialists to look at the benefits of GreenSpace to public health. All the research shows that people can make a real difference to their health by getting out into green space.
Parks and green space are incredibly important for a community. If you ask people in that community or anywhere to say where do they really have those memories when they were a child, the places where they really felt secure and they have those really kind of fond memories, 80 to 90% will put their hand up saying it was a green space locally. It's incredibly important for physical activity and for just the mental health, the restoration of actually going for a walk in a park. Chronic stress is known to be a big problem now for most diseases, so taking away that chronic stress, which a park can do, is important. It's a very, very restorative and very easy way of being sociable for other people. It's a purpose in their life to be able to have and hold and feel they belong to that green space.
One of the big findings of my research was I looked into the benefits for children of spending time in green spaces, and the health benefits were really prominent, both the obvious thing about sort of physical activity, but also kind of coordination and motor development as well. But I think even more significant than that was the emotional health, that children simply are more balanced in their lives because they can spend time in green spaces.
We've got a campaign at the moment which is Feel Better Outside, Feel Better Inside, which is trying to get people to actually become more aware of the role that these resources have in improving their mental health and well-being. We believe they're really important, they're worth investing in and they're worth protecting.
Parks and green spaces are incredibly important for improving health. But they're also important to improve health inequalities, so that we know that people that live in the most deprived populations have much worse living environments than people in the least deprived populations, and this is just simply not fair. It's not just that people need access to open green spaces, they need access to good open green spaces.
At Macmillan Cancer Support, we want people to have safe, pleasant environments for people to become more active. So if a park has continued investment and there are safe places to play, safe places to be active, we'd really welcome that.
With continued investment, you'd see really good facilities, nice cafes, lots of very good play facilities. In bigger parks, a great diversity of experiences that people could have. And that would be things like nature conservation, having a biodiversity area, ponds, etc. You could have formal gardens, areas for sport, areas for tranquility. So offering a whole range of experience.